Hi everyone, I'm Tammy Daniel, Chief Nursing Officer for Baptist Health, and I'm so excited to be here with you. This year has been like no other in our health system, and I'm sure you would agree. But that hasn't stopped us from delivering excellent and safe quality care. We've always been known for that, and even despite the critical crisis that we're in, we continue to do that. Now, let's take a break. We deserve it. From our everyday duties as frontline caregivers and acknowledge some of our best and brightest registered nurses here in our health system, Baptist Health. First up, I'm so excited to tell you about the 7 Daisy Nurse Leader Awards that we will be handing out. Each of our facilities that includes Baptist MD Anderson and Baptist Home Health Care. And then second, we'll be presenting the coveted Daisy Team Award to one of the deserving units. 20 units were nominated for this award, and our shared governance team had to pick only one. Finally, we'll be handing out our inaugural Diane Raines Award. This is a very special award and will go to one of our nurses, and she was selected by her team members. So, with no further ado, drum roll please, it's my pleasure and privilege to host the special video presentation of the 2019 and 2020 Daisy Awards. Let's roll it. Our first Daisy Nurse Leader Award goes to Chelsea Brule. Chelsea is an assistant nurse manager at Baptist South. And said by one of her team members, Chelsea is always patient and always willing to help us, even when she knows she has a lot on her plate. Her calm and positive demeanor instills confidence in all of us, and that reassurance is so good for the newest nurse and every team member, especially during a critical situation. Said by another team member is that Chelsea is always positive, and she's the type of nurse that all others aspire to be like. Her attitude and positivity is always present, and she has a great listening ear. Great job, Chelsea. Our next Daisy Nurse Leader Award goes to Michael Wozniak. Michael is the nurse manager at Baptist Beaches. Go Beaches! And said by one of his peers is every shift, no matter how busy he may be with administrative tasks, Mike makes the time to check on each of his team members. He never hesitates to proactively take on the role of charging, triaging, transporting, stocking, cleaning, toileting, medicating, and most of all, caring. I don't know how he has time to do all of that. Mike exudes positivity and control and continues to build a great team for the patients and for our organization. Our next Daisy Nurse Leader Award goes to Karen Felsinger. Karen is the clinical team manager for Baptist Home Health Care. And said by one of her peers, Karen is a true advocate for all home health patients. She has assisted and supported me in providing care to some of the most challenging patients and always goes above and beyond, showing extraordinary, compassionate care for all patients and families. Great job, Karen. Our next Daisy Nurse Leader Award goes to Lydia Horn. Lydia is the manager of clinical programs at Baptist MD Anderson Cancer Center. Some of her peers have said that Lydia is such a blessing to the infusion center as she models trust, compassion, and respect with all of the staff and our patients too. Said by another team member, I have been a nurse for a long time and have never worked with a manager so willing to help and keep us informed of the many changes in healthcare, and we all know that there are many. We love you, Lydia. Great job. Our next Daisy Nurse Leader Award goes to Denise Austin. Denise is the assistant nurse manager at Baptist Jacksonville. Said by one of her peers, Denise has been one of the most caring and quick-footed, outgoing nurses that I've ever had the privilege to work alongside. I've learned so much from Denise, and I look forward to learning so much more. And another team member said, I admire Denise and her work ethic. She makes me want to be better and better. I hope to one day be as good of an RN as she is. That's so precious, Denise, and we're so proud of you. Great job. Our next Daisy Nurse Leader Award goes to Dina Ross. Dina is the house supervisor at Baptist Nassau. Said by one of her peers, Dina is a senior nurse with a wealth of knowledge, and she makes it a point to make sure that she teaches all of us, novice nurses too, with respect and professionalism. Not only is she supportive of our new team members, she is always first to help in the other departments with any challenge that we are facing. She maintains a calm effect on all of those around her. Great job, Dina. Thank you. Our 7th and final Daisy Nurse Leader Award goes to Karen Grissinger. Karen is the Director of Emergency Services for Wilson Children's Hospital. Said one of her peers, she prefers to stay in the background, making sure the hundreds of tasks on her desk at any given time are executed. Yet, she is never too busy to talk with her staff. She is always there with a Kleenex and a Hershey's bar when the day hasn't gone as we planned. Great job, Karen. We're so proud of you. The Daisy Team Award is designed to honor team members who exemplify our values and our mission as a healthcare organization. They are role models of collaboration and teamwork who make a difference in the lives of our patients, our families, and our community by going above and beyond their traditional roles. The Daisy Team Award recognizes that while one idea to achieve better outcomes may start with just the one individual, it often takes an entire team. This year, it's my pleasure to announce that the 2019-2020 Daisy Team Award goes to Cardiovascular ICU at Wilson Children's Hospital. It's an extraordinary, compassionate, and talented team. Congratulations to all of you. Now, it gives me great pleasure to present the Diane Raines Award. This award is being presented for the first time in our history. It embodies inspirational and visionary leadership, an innovative and creative spirit, exemplary communication skills, and humility. Good morning. I'm super excited to be here today at Baptist South. We're going to give away the first inaugural Dr. Diane Raines Award to one of our members on our nursing team. She doesn't know. She's going to be completely surprised. Her team members are up there waiting. She's one of 180 nurses that were nominated for this award. So let's go find her and give it to her. The winner of this Dr. Diane Raines Award is a member of our Tower 4A ICU. One of her peers wrote, "She has trained many of our new nurses and is a vital resource on our unit. She shows loving and Christian compassion to all of our patients and their family members, always stressing in her teaching to our other nurses not only nursing skills, but how to be spiritually and emotionally charged at all times." She had 4 nominations for this award. I could read them all to you. It would take us all day, but I do want to add from another member of her team. They said that she is the most knowledgeable nurse I have ever worked with. She shows her knowledge and she's always willing to teach, pushing other nurses to be better. She also continues to expand her own education, even years after being in the field. One of her peers went on to say, "I strive to be half of the nurse that she is, and I hope that I can touch a portion of the lives that she has touched." Can't wait to find her and surprise her. Good morning, everybody. Good morning. I know some of you are ready to go. Thanks for waiting. We have a special surprise today. So, without further ado, I want to announce that the winner of the first Dr. Diane Raines Nurse of the Year Award goes to Deb Davis. Dr. Raines wanted to join us this morning.
Gosh, Deb, you're making me cry. I'm honored, first of all, to even have this award named for me, but I'm very honored that you would be selected, and I'm humbled by that.
Congratulations to every one of our Daisy winners, our team, and our Diane Raines Award winner. It's been an amazingly challenging year, and it's time to celebrate. Let's have some fun and recognize these team members, these rising stars among us. Thank you and congratulations to each and every one of you.